Jonathan Sabbagh, welcome to Shrink Wrap Radio.
Thank you very much for having me. I'm excited to be here.
Yeah, it's great to have you here, and also privileged to have my son, Jonathan Van Nuys, here as well. He's been on the podcast before, once or twice, I think. But Jonathan, why don't you go ahead and introduce Jonathan Van Nuys? Introduce yourself again, since Jonathan Sabbagh hasn't met you, and listeners might need to know a little something about you as well.
Thank you, Dad. Yeah, my name's Jonathan Van Nuys. I'm a full-time nurse practitioner. I actually work full-time plus in HIV sexual health realm. But in 2019, I went to California Institute of Integral Studies through their Psychedelic-Assisted Therapy and Research program. So since then, I've also been doing some work at a couple of ketamine therapy clinics in San Francisco. Been working with one called Healing Realms and another clinic called Polaris. So it's been a great journey to explore a new field.
Yeah, great,
Awesome.
Great. And Jonathan, of course, Jonathan Sabbagh, you are CEO of Journey Clinic, and we'll find out more about that as the interview goes along. But you also have a very interesting backstory, and maybe we can start there. Take us through your backstory.
Sure. Thank you very much. And Jonathan, thanks for sharing your background. It's nice to meet you both. I have a bit of an atypical background. I'm originally Swiss, and that's why you have a bit of an accent.
Okay.
I spent the first part of my life, my professional career, working in finance. I worked for 20 years, in hedge funds, doing a variety of different roles, including building two businesses from the ground up. About 10 years ago, while I was building one of those businesses, I suffered a pretty substantial burnout, which turned out to be the result of undiagnosed complex post-traumatic stress disorder. And that led me down a path of a lot of psychotherapy, but also a lot of medication, until about 5 years ago, I was introduced to psychedelics. I started working with ayahuasca, but then with ketamine-assisted psychotherapy for the last 2 years. And that was extremely transformative for me. It allowed me to, get off medication, live in a more integrative life, but it also prompted a career pivot. So I decided to quit finance, actually, and go back to school at the New School and study clinical psychology. So I've been a clinical psych student for the last 2 years.
Very good.
Yeah. That's really been a path that I've felt very fulfilling, but I also felt the need to integrate my background as an entrepreneur and a business person with my long-term goals of being a psychedelic therapist. And so that's kind of how Journey came to be.
Well, that is an interesting story. Where are you located right now?
In New York City.
New York City. Okay.
Yeah.
And the businesses that you started, were those in Switzerland or here in the US?
Both.
Okay. Well, tell us about Journey Clinic, the organization that you founded. Or you said co-founded.
I co-founded. Yeah, I co-founded it with my my co-founder is also my life partner, and she is her name is Miriam Barth, and she's our chief operating officer. She's also pretty amazing. She's done a lot of work in management consulting and artificial intelligence. So she's got her own healing journey, which I would let her share.
Yeah, what a team. And you were talking about ayahuasca, and where did you do that? Did you go to South America, or was that in New York?
It was here in the
City?
US. It was here in the US.
That was, I gather, not in the context of psychotherapy at that point?
No, that was not.
Yeah.
But it was a very healing and transformative experience for me.
Yeah.
As was... Sorry.
Go ahead.
No, please.
Well, I've heard about ayahuasca. I've interviewed people about it and so on, and it sounds like that is a very heavy-duty experience usually for people. It's not a soft ride.
I think it depends on everyone's experience and which ceremony or experience you have at that moment, they can vary.
Uh-huh.
Some can be harder than others. And it's more involved. It definitely is a longer process than, say, a ketamine session.
Yeah.
But it's also very healing. Yeah, I don't know if one's better than the other, but definitely, and you also need probably a little more of a container for an ayahuasca ceremony.
Yeah. Yeah. And by container, you mean some kind of like a group ceremony or something like that?
Yeah, I mean, or helpers who are experienced working with that medicine, and I mean, this purging going on. I think that your defenses are lowered substantially. I guess psilocybin at high doses gets closer to that, but ketamine is a little lower involvement and easier to facilitate either on your own or with a therapist.
Yeah. Hey, Jonathan Van Nuys, I'm probing a lot here. Why don't you jump in with anything that comes to mind?
Are you also one of the therapists, or are you involved in just training therapists?
Not yet. When I graduate, hopefully someday I'll get to be, but I have to take a sabbatical because you can't build a startup and be in school at the same time. But eventually, I certainly hope to be able to be a therapist myself.
I think that would be wonderful. And what was I going to ask? So why did you choose ketamine? I mean, I guess that's all we have that's legal right now, but what prompted that choice to go that route?
Do you mean me personally or for Journey?
For Journey.
Yeah, I mean, I think that to put a little bit of context on what we're doing at Journey, it's important to understand that what we really are effectively is a decentralized clinic model. And what we offer really is the opportunity for independent psychotherapists or small practices to be able to offer psychedelic therapies in their practice. And so we really looked through what was the main barrier to entry for psychotherapists to offer psychedelic therapies in their practice. And when we did a survey, we interviewed a couple of hundred people, and we surveyed and we had some responses on a large portion of the population. And what we found was that, the number one barrier to entry really was finding a prescriber. And, when you start to talk to the prescribers, you start to look at what building that process at scale looks like. And it's just impossible, because everybody is self-employed. And so really sort of like guaranteeing access to a prescriber and building a nationwide service that helps expand access to these medicines, really building a sort of like delivery mechanism, if you like, was what we wanted to do. And what we found really was that it was much more effective and, also ethical, we found, to empower these self-employed practitioners to be able to offer them in their practice rather than building another large centralized clinic. And that's because they're already embedded in local communities and they have a relationship with that patient population. And so that's kind of like what we're building. We basically internalize the prescriber function. We take on all of the psychopharmacology while we support our members taking on all the psychotherapy. And we're building effectively a collaborative care model. And that really helps place the patient at the center, that optimizes clinical outcomes. And it's really, in our opinion, the most effective route to expand access. Now, we're a national service, but when we looked at what's offering, well, you hit the nail on the head there. It is ketamine because ketamine is what's legal now, but we are really sort of trying to solve for an infrastructure solution that will help funnel through all of these medicines. So we're working on partnerships that hopefully will allow us to do this effectively and responsibly.
That's great. So you say you're building it and we're of course in the pandemic. So I'm wondering, have you already started offering these services, or is it in the process of being constructed?
Oh yeah, we're up and running. We started in April, and we've got our member therapists who've been running. We ran a closed alpha group, and we're expanding now the offering.
Because you don't actually have to have a physical presence with anybody, right? This is all done virtually.
Well, our part is done virtually.
Yeah.
Our member therapists are free to either do this in person, and that tended to be the the majority of what we've seen, people sort of want at least to start off in person, but we could support a remote offering.
Yeah, yeah. So is
What we do, what's important to us is really support CAP, right? So what we are supporting is someone in a therapeutic relationship. We're not just prescribing, we're not a pill mill, we're not prescribing ketamine to people who are not working with one of our members. That's really, we're trying to support that tripartite relationship.
is your organization, is this a unique model, or do you have competitors?
I think it's a unique model. I mean, I know of others who are starting to think about the same thing, but we were definitely the first.
Yeah. And Jonathan, how does this model compare to your own experience working with ketamine-assisted therapy? Jonathan Van Nuys.
Yeah. So you're connecting prescribers with therapists who may not have the ability to prescribe. Is that
we are the prescriber?
Either. Okay. Yeah, I work at two physical clinics, and they both have slightly different models. Both run by therapists. One of the directors is actually a medical doctor, so the prescribers would be him and myself. The other practice I work with, they also have a medical doctor that does the prescribing. At that clinic, I'm more in a RN role where I'm just giving the injection, but the healing realms, I actually work more in sort of a therapeutic context. We've actually been co-facilitating a group looking at HIV and HIV stigma, which has been very rewarding. Yeah,
that's awesome.
Yeah.
So, Jonathan Sabbagh, are there any challenges have you had to overcome? Have there been any obstacles or challenges that you've had to work through to make this happen?
Yeah, I mean, when you build a business, that's what happens. Everything sort of breaks, and you're sort of like trying to see how the boat floats a little bit and plug the biggest leak at that moment. So there's a lot of challenges all around, and we're working with people who are offering a new modality, and so offering a new modality creates new challenges. And so I think that it has been a wonderful opportunity for us to work with our members who have given amazing feedback loops on we speak to them on a weekly basis, and every week there's a new challenge that comes up, and they're usually linked to sort of like incorporating this modality in their work and gaining some comfort with it. But what we've really found was that we've been able to, I think, answer their needs pretty proactively. And once they start to get comfortable with this, they've actually been quite active. So it's been a really interesting evolution to watch people sort of like gain their footing, come up with a variety of questions, which are theirs. I don't want to share everybody else's questions because it regards them, but really like nothing really business stopping. We've been really able to overcome most of them, and it's been amazing to watch how quickly the comfort level of incorporating these practices in their offering was.
Yeah. Can you share how many people are in your network of providers currently?
Yeah, I mean, right now, so we very purposely decided to keep a closed group at 20 people. And that was because we're building something called a minimum viable product, where we wanted to basically, see what broke. And a lot of stuff broke, as you can imagine, and a lot of stuff worked after. We fixed a lot of stuff, but we've got a wait list, and we'll be opening up so we've got like about 50 people on wait list, and we're going to start. So we haven't done any marketing yet, but I think that in the next month and a half or so, we'll be opening up for new members and on.
How about Paul Austin of the Third Wave? Any contact
I know Paul.
with him?
Yeah,
Do you know Paul? Okay,
I do. Paul's great.
Yeah. Because I've sat in on some of the promotional, he's done promotional things using Facebook among other outlets. And I know there have been a lot of people that were very interested in what he was doing, both, and quite a few from the psychotherapy side, people who wanted to be trip sitters. Yeah,
they've definitely built a huge following. Sorry.
Yeah, good. So you're well anchored in the scene that's going on. And something that I've been hearing from a couple of other people that I've interviewed is that this is it's on its way to becoming an industry that some people are seeing like a huge financial opportunity.
Yeah, I think that's true. It makes a lot of sense. There's all the signs of the psychedelic industry becoming a tremendous opportunity. And there's a lot of sort of like venture capital money flowing into the space. So a lot of people are getting funded. And, that's, I think it's a good sign. I think that having these interests start to build in new inroads or new infrastructure solutions, I don't know if it's fortunate or unfortunate, but that's the way sort of things evolve and we go towards mainstream adoption. And if that's what we're looking to do, we're trying here to not really disrupt the pharmaceutical or mental health market. We're literally it's not basically bringing Uber to disrupt taxis. We're literally bringing in a flying car here. So we really need to, we're changing an industry. We're bringing in a new modality. And so there's a lot of people educating about it. There's traditional investors looking at it. There's psychedelic investors. There is dynamics between grassroots movements, media. So I'm extremely excited at the fact and prospect of being at the beginning of an industry, which I think is going to change the way we approach mental health.
Yeah.
How do you think, in terms of access, how do you think we can increase access? Because it is quite pricey, for the most part, and out of reach for a lot of people who may benefit and actually need it. So how do you think we're going to solve those issues to increase access so that for everybody who could benefit from it could be able to access these medications and treatments?
Yeah, that's a great question. It is very expensive. And in general, in America, I mean, I'm Swiss, so I come from a culture where, you have universal coverage. So it was a shock for me to experience the American healthcare system.
It's a shock for us too.
Yeah. No doubt. And, obviously the first solution is having insurance cover these treatments. That's really the best way to expand coverage or access. And there are people I know working at creating riders. There are initiatives in the space, but getting these larger payers to take it on is going to be one of the important factors. That being said, payers taking on, coverage of certain types of drugs or medicine, that will create some pressure on the companies themselves. And those dynamics are also complicated. So we'll see how that's going to pan out. There's a lot of task force, and we're very interested in being an advocate and participating in pushing for that policy. I think that then it's a question of, organizations offering sliding scales, maybe accessibility funds. So we've for example, at Journey Clinical, we've considered, creating a structure for sliding scales, creating maybe an accessibility fund where we can, help people get access to these medicines. And, our challenge is a little bit different because we are working, our clients are first the psychotherapist, and then we support the patients through them. But if you look at there's a lot of problems, like for example, psychotherapists who are in minority communities where they're not being paid themselves are having access issues. So the chain is complicated. So there's the needs for diversity funding or diversity considerations, this need for increasing accessibility. And these are things that we're thinking about at Journey Clinical to be able to expand upon.
I hear you saying Journey Clinical, and but your email address says clinic rather than clinical. Yes. Is the name changing?
No, it's always been Journey Clinical, and our domain when we did the email address is journey.clinic. Yeah.
Yeah. Okay. Yeah. And so are you going to become a referral network, like somebody who's looking for a psychedelic assisted psychotherapy? Are you going to be have a list of people to refer people to?
Yeah, we're absolutely going to have a directory on our website where people can find our members. And we will also be referring patients back to our members.
Uh-huh. Yeah, that I'm sure that will help it to grow as well. Yeah.
Is training also part of your offerings?
Yeah, we're working with, a company called Fluence is developing training materials for us. And it's not a certification, but it will be ketamine orientation. We're also only working with licensed mental health professionals, so we're not working with coaches or people who are not licensed mental health professionals. So that also limits our scope we're trying to ensure that people are working with those kind of people.
Yeah. So what's the most rewarding part of this work for you?
I think that first it's working with, I'm biased because I want to be a psychotherapist. So these are my people.
Yeah.
So I really have a lot of fun. I think the most fun I have is really sort of like speaking with them and listening to their needs and helping them, build out their practice and really seeing, I think some of the most rewarding things that we've seen were the feedback from our members. One member, she said that Journey Clinical was her practice what ketamine is to therapy, which I thought was pretty amazing. And really being able to, help them incorporate that in their therapy as a tool really is something that I found very, very rewarding.
Yeah, yeah. Jonathan Van Nuys, anything else?
I bet the therapists that you work with reported just improved outcomes now that they're using ketamine and they have ketamine on board, that they're able to have more success in terms of helping people, maybe helping people emerge from a depression or difficult episode more quickly.
Yeah. So you mean how many? I didn't quite catch it.
I was just wondering what kind of feedback you've been hearing from the therapists who are newly using ketamine in their practice, and how that's perhaps deepened the relationship with the clients or accelerated positive outcomes.
That's a great question. We've had quite a few, actually. Some of our therapists, they're very active in communicating with us. And so some of them just actually message us right after their sessions and let us know how it went. And almost every time we've heard that it helps, it has changed dynamics with people who have been stuck for years and who all of a sudden, after very few sessions, have really cathartic events and have been able to move their therapy along. And it's been very, very consistent as a feedback from people who have been working with these patients, and the enthusiasms that we've seen from the therapist has translated into them referring more of their patients.
What form of ketamine are you providing?
We work, because we are a remote company, we work with sublingual ketamine.
Sublingual.
Yeah, rapid dissolving.
Yeah.
And troches.
And I'm wondering what range of therapies people are using. We're talking about it as if there is a thing, ketamine-assisted psychotherapy, but within that, I imagine there might be a variety of therapeutic approaches. What are you seeing?
I think that's a very important question. And what we're seeing is a huge variety, as you can imagine, of approaches. Some people are going to use ACT, CBT, they're going to be psychodynamic or psychoanalytic. And what our model is actually providing a flexible solution for them to incorporate ketamine and other psychedelics, it's not just ketamine, as an adjunct to therapy. And so those tools must be used in a flexible way. We don't believe at Journey in a cookie cutter approach to care, right? Having 6 treatments, 6 sessions, coming back and sort of, outlining a standardized model for psychedelic treatment is not something that we believe is reality. And it's not what happens really. And if you look even in the clinics, people come back for boosters. It's not so linear. And so what we're trying to do is actually let people have their style and their approach. And actually, because we've got such a consistent dynamic between the prescriber at Journey and our member psychotherapists, there's a lot of communication that goes on. It's a lot more involved than you would think. And actually, we're able, with our model, to support them in a way that matches their approach to care.
Well, that sounds great. This all sounds very exciting to me.
Oh, thank you.
Yeah, and I really am impressed by the integrity that I sense that you're bringing to this.
Well, thank you very much.
Operation. Yeah. So we're going to keep our eye
Oh, good. Yeah.
out for your rising star.
Oh, thank you so much. That's very kind.
Yeah.
You know, we for us, everybody at Journey, I think I can speak for most at least, these medicines have changed our lives in one way or another. They've heavily impacted us. And I can speak for myself that I've chosen this path because I felt the need to be of service, but I also wanted to be true to myself, and I wanted to find a way that made sense to me. And so we are a for-profit company, but we're also mission-driven. And I think it's very important for us to be able to do this responsibly and in a way that, that makes sense, that brings healing at scale.
Yeah. Is there anything else that you'd like to say? This is your chance to speak to our part of the world here. Maybe there's some question we haven't asked that, would elicit something that you were hoping to get in here.
I think that we're just very, very grateful for the amazing work that we're getting to do, with the partnerships that we're starting to build, with the members that we're getting to know, and we're very excited about expanding this business to what we think is going to be really, hopefully, the platform for people to offer psychedelic therapies in their practice in America. We're very, very excited to go on that journey with them and to learn from them, and to be of service to small businesses and independent practitioners who spent all these years just honing this practice, and who really are, in our opinion, they're the majority of people who should be distributing these medicines, and we're excited to support them.
Yeah. All right. Jonathan Van Nuys, any other questions?
Yeah, I just think it's a great opportunity. It's an exciting time. I think these medicines, because it does seem to interrupt the default network mode and just offer a real chance for a shift and change and a moving past stuckness. I can tell you from my own life, I had a really different kind of introduction to ketamine, and that I had developed a condition called trigeminal neuralgia. I don't know if you know what that is, but it was a pretty debilitating nerve pain at the side of my face, probably resulting from a gum surgery. But it kept getting worse and worse to the point where I couldn't work. I had to stop working, and I love my career. It's very fulfilling. So that was frustrating. And I was out of work, or just couldn't work, for about a year. And I tried all of these different psychoactive meds, antidepressants, things that are supposed to cover nerve pain, but they made me too clouded to feel like I could go back to work. And I just grew really depressed. But eventually I made my way to a neurologist through Kaiser, who said, I want you to try ketamine. She said, half of my patients get amazing results, half get nothing. And I thought, okay, what do I have to lose? Let's try it, at this point. And my dad actually went with me. I think it was maybe a 48-hour IV infusion, and it was profoundly transformative. It felt like I felt a bit broken at that point, and I felt like I got healing. It just shifted something where I went back to work maybe a couple weeks later, and this is June 2016. I've been working full-time plus ever since. So it's very healing, both for the physical pain. I mean, it didn't cure it, but it dialed it down to a level that it is more tolerable. But just also in some kind of mysterious emotional way, there was something greatly transformative about that experience. So that spurred my interest, just to see the healing potential that these medicines can have. I was pretty blown away. It was like my last shot kind of deal.
Yeah.
That's amazing. Thank you for sharing that.
And as a witness to that process, I have to say it was really transforming and impactful, because Jonathan was really paralyzed in terms of his career, his hope, his optimism, all of that, isolating himself from longtime friends and so on, and it just turned right around. My recollection of it, Jonathan, was that it was a 24-hour infusion, and because I was there waiting, so I
You were on an
being,
infusion for 24 hours?
yeah.
Wow.
Yeah, so like a drip of some sort.
That must have been a hell of a journey.
Yeah.
Yeah, they don't.
And dialed it up slowly as I was operating.
And they don't even at that time, they weren't even billing it as particularly as a psychedelic thing. They just kind of, in a cautionary way, said, some people find this to be kind of psychedelic. You might have an experience of one sort or another. And the experience that Jonathan had, and I'm speaking from the outside, you can correct me, Jonathan, if I'm getting any of this wrong, was not, it was subtle in a way, was that his mood just really shifted. He started, he had his iPhone with him. He was communicating with family and friends. He had asked his friends to send him playlists that he could play on his iPad, whatever it was at the time, and just communicating with people and asking for love from everyone and getting bombed with lots of love, and that's what it was. What? Yeah. Am I getting this right, Jonathan? Or do you elaborate on
it? Like just a return to myself.
Yeah.
Just brought me back.
So it was kind of subtle. He didn't have any hallucinations or anything. Actually, I think the staff, the nursing staff there, probably thought that he was having hallucinations, because while he was there, and he had been in the depth of despair about ever being able to return to his work as a nurse practitioner, he got several job offers. Oh, and wow. So the nurses would come in and say, I got a job offer. I got a job offer.
That's wonderful. That's so funny.
And so that was rather remarkable and wonderful.
That's pretty great. Thanks for sharing that. Have you done it again?
Yeah. So in that context, I did go back. I've gone back maybe 3 or 4 times for sort of boosters, 6 months to a year apart when needed. And I've done shorter ones now. I did a couple of I don't know if it's 24 or 48, and then a couple in the OR where it's just they flood you and you're out for like 40 minutes. But it really does help with the nerve pain.
That's wonderful.
Yeah, and they try to give you benzos, which I refuse, because I think it is an odd setting, to be in a hospital, in a cardiac step-down unit with the machines beeping and all of that. But fortunately, my friend did make me a very curated playlist, and I just put on those earbuds and closed my eyes, and all of that fell away. And so I was sort of able to create my own, container and setting for it.
Did you try working with Mendel Kalen's work?
No, I'm not familiar with them. But
they've got he actually has a company called the Wave Paths, and we have a partnership with them also. And we work with them, and they have sort of like a very specific curated playlist, but also platform where you can sort of like build, playlists for psychedelics. And so, even just like checking that out is pretty cool.
What was the name of the
Wave Paths?
Wave, WAVEPATH, Wave Path? Okay, great. I'm sure some of our listeners / viewers will want to follow up on that.
Yeah, they're pretty amazing. Yeah.
Yeah, I'm not surprised to hear that. I know that there are people who've specialized in music therapy, prior to this, quite apart from psychedelics. And I would imagine that and I think part of the ritual of what's evolving is some kind of music in the background. So I'm sure there there's going to be a market there. Therapists are going to be wondering, well, what should we play? What do we need to have available?
Yeah. I think that, I mean, I don't know how familiar you guys are with, traditional like psychedelic settings, but set and setting, the concept of set and setting is a tremendous part of the psychedelic experience.
Right.
And, music, I think in itself is if you put an eye mask on and you have the right music going, that'll do it, right? And so if you're given it,
yeah,
it will really like guide your experience and
Uh-huh.
have a tremendous impact. And even if you look at more traditionally like ayahuasca ceremonies, where there's really like Icaros, and those are built out in a very specific set structure to sort of like tailor and guide the ceremonies to certain to certain types of experiences. It's a tremendous part of it. And so having the right music and understanding how that impacts the psychedelic experience is, in my opinion, essential.
Well, Jonathan Sabbagh, go ahead, Jonathan Van Nuys.
I agree. The music's so supportive, and I would not recommend the hospital setting as the ideal.
That's not the best place to do it.
I was sort of able to make my own set and setting, and I had to shoo the nurses away who kept trying to like offer me stool softeners and stuff. No, I'm leave me alone. But there are much better settings that I think people can find. But yeah, I agree. The music's like integral. I don't know that I would have had the same healing experience without the music there.
100%. I can definitely attest to the impact of music in that setting, and it really guides like the whole experience. I find it's very very impressive.
Well, Jonathan Sabbagh, I want to thank you for being our guest today, and I want to thank my son, Jonathan Van Nuys. Having you here has added a lot to the discussion as well. So thank you once again for being my guest on Shrink Wrap Radio.
Thank you so much for having me.